when we're doing great on time, very much on time. This is when we have the speaker panel, and we'll have Dr. Jorge Venegas moderate the panel for us. Please, Jorge. And inviting all the speakers to these beautiful chairs up here. And I'm sure you thought about some questions you had for the speakers, and there was a lot of topics that just triggered some questions for me as well. You have cards where you can write down the question. We can collect those and bring them to the moderator.
All right, it's a pleasure to be here. I'm a fully committed person to the cause. I already learned a lot, and I am going to use this chance as what I call the seat of heat with the questions that are not going to be normal. So if they were normal, you wouldn't have me here. So the first question I have is, I come personally from a background in capital projects, facilities, infrastructure. That defines the world we have today. It surrounds us on everything. And here we are talking about nature. And I believe that the built environment plays a tremendous role in enabling and ensuring access to clean and safe and natural spaces. But as we have seen in some of the data presented, not everybody has access to that. So my first question, and there's no order, so raise your hands if you want to jump in. How can we make sure that this access is available to all communities? And especially those that are marginalized, underserved, and economically distressed. Nature is for the whole world. How can we make sure that the people that perhaps need it the most have that access, that the built environment is not the obstacle? Who wants to take a shot?
On? Okay. Well, I mean, as I was indicating in the presentation, I think there's a huge hurdle financially. I think there's a lack of will. I think there's a lack of political power in a lot of the vulnerable communities in order to enact the change that they deserve. So I think it would really take, if you're talking about genuine all access, I think it would take a major change in our culture and where we put our dollars. I think it can't happen. I think from the bottom up is a good find solutions. I think in order to get the type of access required, really would have to be something at the federal and state government, and would require a tremendous amount of will and dedication from a lot of different people to be able to make it happen. So I'm hopeful of incremental change. I'm not as hopeful for a total overhaul of the experience.
Anybody else?
I think I completely agree with what has been said. And there are a lot of delays. There are a lot of policymakers, urban designers, stakeholders involved in this. And our job is to provide the evidence actually to them and prove that this makes difference. Because just saying going in nature is helpful or the access is helpful, it doesn't make sense to them. So, but providing them and quantifying the measures by saying how this can be helpful. This is half-rest, for example. This can really push, I think.
I saw your hand go up.
Yeah, just to echo some of the previous argument, especially about incremental changes. What our group would like to advocate for is nature at every doorstep. In terms of planning and policy, we could build central parks or the High Line. But we already see there are issues, social issues related to those centralized big projects. So what really could benefit some of the marginalized neighborhoods are, community gardens, those small urban or neighborhood insertions. Some of my colleagues work on vacant lot greening. So these small efforts could make a big difference.
Just add, is this on?
Yes.
Okay. I would just add exactly what my colleagues here have said, that we as scientists and researchers, can think about who our teams are and who's contributing to the questions that we're asking. So I think that's something that we have complete control over. And we can use some lessons learned from community-based participatory research approaches, where we're involving not only, interdisciplinary faces and representative faces around the table, but we're also involving the community, like what you're doing with the citizen science, and having the voices that would be impacted as part of our research design and agenda.
Actually, that's a perfect segue to my second question. So just imagine for a second that you're taking a stroll in a nut. You find Aladdin's lamp, and you rub it, and a genie appears and grants you a wish. Your wish is for research tools and technologies and approaches that have yet to be developed, but that would, in your opinion, provide breakthroughs from your research. We tend to use what we have always used and where we are now. I'm telling you, take a leap forward. What would you wish for? I warned you.
Feeling that heat of the seat, right?
Now you know.
Well, I guess I'll take a little stab. That is a big question. It's tricky, but for me personally, as I said before, I kind of started in this field a long time ago and felt kind of lonely in that. So what I would wish for is this type of collaboration. So it's developing, it's here, the foundation is here. And I think that the more voices, again, the interdisciplinary voices coming from different approaches, the different folks who are involved in this, thinking about it and coming together and asking questions together is what I think the big thing that I would wish for. So,
All right, I'm gonna try to think past. I'm gonna try to really actually answer your question, to think beyond what I want in the near future, and think way. So I think maybe our greatest risk and greatest potential probably lies in artificial intelligence. And I think if we're going to come up with these systems, right, thinking general intelligence machines, and I had a genie, I would say it has to be benevolent, and approach issues genuinely through an equitable lens, to figure out how we can function. Because I think all of this is just humans interacting with humans, and how we decide to spend our resources, and the ways in which we can convince each other of what's important and what's not important. Again, that's why things like the Center for Health and Nature are so, you have to do something like this. You can't just research things and nothing's going to happen. But to be able to have, again, an AI to push forward to answer the questions for you. So I'm a little cheating, because I think the answer is something else needs to come up with a better answer. I'll just say one other thing. So when you look at examples around the world, so like Antwerp is starting this green highway project where they're putting a whole major highway underground, and it was based on community research projects. South Korea turned one of their biggest highways into a artificially created river, right, and a green walking space. All of that came about through tremendous research, but really nothing happened until you're with centers of power that, like, different research institutes that were able to convince and persuade elected officials and people that can actually put the resources to making those major changes. So I think the way in which we can make that shift through whatever means necessary is probably the only way to push it in a large, impactful way.
Any of you?
I
You can
think,
always take a pass.
like, at my stage of postdoc, I would definitely ask him to get me all the data out there and do the analysis. That would be very helpful.
More analytical tools.
Yeah.
You have a wish?
I was thinking the same data. So the Internet of Things and sensor network, I feel like that's really important. Getting us, sensor data from the environment as well as biosensing from like people, but in a way that protects privacy. That gets rid of the ethical issues and give us the data that we can use to build smart cities without like harming any individuals. That would be something I would like to see.
Okay, excellent. Now, I have been receiving some questions from the audience. I'm going to ask my last third question, and then I'm going to start trying to catch as many as the ones we have here. So we've gone through Aladdin's lamp. Now, the next one is you continue your stroll, but this time you find Harry Potter's wand and you decide to cast a spell that creates something that we don't have, which is a continuously replenishing pot of gold to fund studies in any aspect of health and nature. What would be your choice to use these unlimited resources? Money would not be a problem, but I want to know what is the problem that you are going to attack.
So I think the Framingham Heart Study kind of, I mean, most of what we know about healthy living as it pertains to heart health is through the Framingham cohort study. I think we need a longitudinal cohort study that looks at complex chemical mixtures over a long period of time. So we have decent toxicological models for individual compounds or even similarly grouped chemical exposures. We don't for complex ones that you typically see in certain urban communities. And I think that would be able to make a lot of major decisions on exactly what certain types of exposures, either good or ill, have on individual health throughout the lifetime. So this would be a lifelong cohort study or even generational. We've got a pot of gold to be able to make those decisions. Again, major policies are done based on the Framingham study. And I think something like that we're due for something like that on complex chemical exposures.
I would say if we had unlimited money, I really like the idea of test this versus this. I mean, obviously, it's like that's the way. So I would really like to be able to design exposures where people are, and I would think about the community or urban settings. So designing parks within a certain distance from people so that there's access for all people. So if we had money, we would create those things. That's what we would do is we'd create the interventions with the money. And we'd also remember that we, whether good, bad, or ugly, spend more than 90% of our time in indoor environments. So we would also think about those spaces and how to design those spaces with people in mind. So I think I'd want to put the money in creating the stuff and then testing.
Relate to that. So
Yeah, I couldn't agree more actually with this. Like I've only thought of having longitudinal studies. They're very expensive. Collecting the data here and there, and of course the intervention studies. That's the part I always love, and I very like the idea like to create things, bring nature to people and increase the access. This is one of the problems we actually have. So I wouldn't agree more.
Yeah, I also agree with longitudinal studies and studies that can establish causality. Personally, I would do like a realistic three-dimensional digital twin models or to test different ideas of different design for green space. For example, like we can design a park or a neighborhood, and then we can build a digital twin model and have people walk in that neighborhood using VR goggles. That's very costly, but we can, if we have unlimited resources, we can build in climate change scenarios and other projection scenarios. And then we can just test out those ideas and see how people feel, how does it contribute to like flooding, solving flooding or air pollution issues, all those different things.
All right, here comes the first question from virtual land, because we also have people that are connecting here virtually. So the built environment is also often very bright at night. Anyone doing work that includes access to dark skies, stars, and its connection to public health? And by the way, in this case, whoever wants to jump in, please.
I'm not doing research in that area, but we do have a project going on at University of North Florida with our students. We have a community environmental leadership program where students work with community partners, and one of our partners is really passionate about that. So we have, it's related to birds, Duval Audubon Society, and it's trying to dark the downtown, which has obviously implications for public health and safety. So there's lots of things to consider. And also in Florida, and I'm sure here as well, we have turtle laying. So we have a lot of kind of efforts in technology and related to balancing the fact that people need to be outside and be safe, and also to think about those implications. But that's a really interesting question.
Yes. All right, another virtual. This is from Julia Murphy. I teach sustainability and green building at UTSA. One of my guest presenters, a biophilia expert, posed this question to my class. Imagine your client is an animal. It was a great way to reframe how we think about integrating nature into the built environment. Thoughts? That kind of question.
Well, I like the idea. I think when we pretend that when we build cities and systems where we pretend that we're not part of nature, I think we have that's where we have the major disconnect. That's where we have the pictures of the office that you were showing, where it's just nothing but gray space, as if we're separate from it. So I think acknowledging and integrating that into our lives and research and the ways in which we build cities makes sense. I think maybe that thought experiment is a good way to do that.
I would also add to that too. I think that thinking from the perspective of the animal or the ecosystem is also important for us. And I didn't mention it, but I was tempted to throw it in as an assumption, but I didn't. But when we talk about nature and integrating nature in communities, especially when we think about parks and other sort of opportunities for people, we always think about it for people's sake. And I do think that we need to think about from ecosystem's sake, and there are implications too. If there are implications for everyone having access to nature, then what does that do to the large tracts of nature? Does that break up the large tracts of nature by putting people in it? And then what does that do to the ecosystem and to the animals? So that's a really interesting question.
I'm just going to add my own perspective on this one. Center's name, Center for Health and Nature. It does not say for people only. So I think that it opens the door for other types of research that we are really not looking at. We talk about health of ecosystems. They have a life too. So
Right.
I found that question very provocative. Okay, this one is actually for Omar. Is there a compelling amount of research on mental health utilization of nature areas? But key part of this question is, what inroads do we have with mental health clinicians, available insurance, and all the peripheral actors that have health as part of either a barrier, inhibitor, or enabler?
The data we have, we don't have much data about the health insurance, like what types of health insurance, if I got the question right, what type exactly of health insurance, so we can clearly say if this is related to a certain type of mental health utilization or healthcare access. So I would love to investigate this area, but haven't done so far.
Okay, so there's a related question to that one.
Okay.
I have heard a doctor, and this can go to anybody. I have heard a doctor say that patients don't like nature prescriptions because it's telling the patient what to do. What do you think of this, and what are the other options that healthcare professionals could use to encourage outdoor time?
That's something that we were trying to do in Jacksonville, which was the feasibility, and we're still working on that. So the feasibility, what do the clinicians think of this? What do they know? What do they not know? What do they need to know? And that's definitely an area I think that's prime for research, is more on the feasibility, kind of take that first, step one, but.
Well, I chose the type of work I do because I don't want to tell people what to do. And I think we have a history in health promotion. A lot of it doesn't work if you tell people what to do. So if you're taking if you're taking into consideration things like access to green space and walking and walkability, what's shown to work time and time again is just building it into the systems in which we live, not telling people to do it. So, I mean, one thing I always ask my students, if when they come back from summer, is like, well, did anybody go to Europe or like this kind? And if I'm always like, well, what's one of the things you noticed? They're like, well, we walked a whole lot more, we rode a bike a lot more. It's not because we don't like riding bikes or we don't know what walking is here, right? It's just we don't have the systems in place to make it convenient, easy, and just part of our everyday life. So I think just being like, go out in nature probably doesn't work. What we do is we have to build in nature into just our ecosystem and a way in which we operate and live and the way that the city is. And I kind of think it's unfair to make doctors. I mean, I think it's a good thing for them to tell them to get outside. I just don't think the time that they're going to have with patients really would be even enough to be able to convince them of anything. I think we just have to build it into the environment.
Here's an interest. Oh, go ahead.
Sorry, just a thought. So we're conducting a study where we are designing a protocol for a nature walk. And then in that process, we are working with some other people to build in fun parts, like you can walk in nature with your family members or your pets, or you can do different types of meditation that could contribute to your work, like a reflection on your work and your family relationships and stuff. So it's not just go out and walk. If we can develop some like guidelines where there are fun activities, like a scavenger hunt or discovery kind of process that can also go into that, making it something that people would love to do.
Really good segue to this question that I find extremely intriguing. Now, what you're describing is walking, so like recreation and this one. So could the PGA be a good partner for the center? Walk, play golf. A doctor could prescribe, hey, go play golf. So why not have the PGA be a good partner for the center?
The PGA is a partner with us in Jacksonville also, and they're very interested in this. So the players, is that the right? PGA players, yeah. So they are affiliated with the institute that I'm the director of, the Institute of Environmental Research and Education at UNF. And they're very interested in not only nature and getting people out, but also the sustainability related implications of their work. So definitely, I think a good connection.
Excellent. All right, so here goes another one. And I think that this one goes to Dr. Sampson. Has there been any discussion or interest in expanding citizen scientists to businesses, employee engagement, resource groups, and not only the kids doing also data collection, but adults doing the data collection, volunteer part? I know that you said citizen scientists, but not necessarily children. So is there any discussion in actually applying that in a much broader way?
Yeah, a good question. It's one of these things that started off as well, let's just kind of engage with some high school students, and now it's one of the 5 years later, it's just one of the biggest parts of what I do. And so yeah, we already have, so we don't work a lot with businesses, although that's a good idea. I haven't thought of it before, but we do engage with a lot of adults. We typically don't use the phrase citizen science. We'll use the phrase like block captains or community captains. And we'll train them on, if they're adults, it's great because they can actually help with primary data collection. They just have to go through human subjects research training. And there's a lot of paperwork involved with that. But they've done that. And so there's a lot of communities that we operate in that if, some researcher from A&M just shows up knocking on doors trying to recruit people, it's unlikely to be successful. But working with the community and building up the block or neighborhood captain programs has really increased not just the scholarship, but also sort of the ethical way in which you operate in communities. So yeah, we've done that quite a bit. We've been building it, but it's always can be better. And I like the idea of engaging with some businesses or nonprofits and stuff to kind of kick it up a notch.
Oh, this may be generic, but it's related. You think that students and adults have comparable astute observation skills within nature? Because I know that you have done studies all over, and they include all kinds of ages and everything. Is there anything that is being done on how a child sees nature versus an adult sees nature? So that's another dimension. Interesting question.
I can speak anecdotally. Equally valuable and different. So we can get jaded as we get older, but I think there's a beauty and the whimsy of working with the younger kids, and they see things in a more true fashion, whereas without the knowledge of all the barriers to make change, and working with adult groups, they're knowledgeable of all those barriers, and it becomes cynical and more difficult for them to believe in large scale positive change. But I've never actually researched it. It's just been working with a different group.
Okay, yes.
We've done qualitative like interview or mapping research with children and also interviews with parents. So we do find that perceptions are often different. In the child group versus the adult group, children are typically more adventurous and they are less worried about safety issues and stuff. But we also found that children's perspectives are highly affected by their parents' perceptions as well.
Okay, this one is, many of the proposed solutions often come at the expense of the community who lives there through green gentrification. How is this addressed when designing studies? I would add my own commentary on this, that sometimes you have unexpected results. When we are trying to revitalize and do everything, it may not necessarily serve the people that may start out with a need, because others pounce. How do you deal with that human nature? We'll also include in our studies.
Well, I don't know, totally. So I think gentrification is one of the biggest fears of community, improvement, quote unquote, because the folks who've been there for generations all of a sudden get bought out. I mean, all of Hawaii is kind of experiencing this right now. But I grew up near Austin. East Austin is unrecognizable. Kid. Now I will say there's been some attempts. I don't know if this is the right one of basically it's locking in tax burdens or offering supplemental income to folks who are from that area. When property taxes increase, it offsets those costs so they can stay. That tends to be the only solution I'm even aware of that's even been attempted in a lot of those areas to mix results, but at least it's acknowledging that issue and trying to come up with some solution to it. But I think that's probably going to be one of the biggest urban planning issues moving the next 20 years.
I think that the nature and money thing is embedded. It's just such a hard nut to crack because You even think what neighborhoods are the most desirable, or the greenest neighborhoods, the most walkable neighborhoods, aka the healthiest neighborhoods, and thus they're more expensive, and that compounds over time. But even when you think about, again, indoor places, you think about your corner office with all the windows where you spend all your time, you're spending 95% of your time in that space, versus the person who, with the low income, who's working in a cubicle, and that's where they're staring at their little screen all day long. So I think it's an important thing to consider and really tricky. I don't have an answer necessarily, but just to say that, yes.
Okay, this one I find also very intriguing. You're here preaching to the choir. How do we get better at communicating our findings to the general public? I may add a little corollary on that. How do you capture the power of the influencers that take people in the wrong path, become influencers to go in the path that we all share and want? That's thinking really outside the box. Can you imagine a TikTok health and nature challenge? That are the stupid things that people do.
I think with this, in your presentation, Omar, where you talked about the impact of your work and being able to quantify that, I think we need professionals to help us. We can't do everything. So I think having professionals that can help us get the word out and get it out in a professional way. In the flower and health study that I talked about, which kind of drove me crazy, we did have professional help, but that was externally funded, and there was help, and we also had an impact similar to that where it was just everywhere. And the contacts related to that study are just endless. So I think that we should be purposeful in terms of how we take the research to advocacy.
Closing comment.
I just wanted to add that I feel like it'd be good if we not only include people after we found out our results, but from the beginning, participatory research where the beginning of the research, it's their questions, they have a need, and we can come in and help them design the study, and then that finding would be directly feeding back into their daily practices. So I feel like that would be a good one.
Thank you. Full disclosure, I apologize for not being able to get all the questions, but some of the questions that were posed by the audience and virtually have been addressed indirectly in other questions. So my apologies if your question was not directly read. And with this, I would like to thank our panelists for surviving the heat.
Thank you, Dr. Venegas, and our morning speakers. What an amazing morning. This was so fantastic. I learned a lot. Thank you for the questions. I mean, some of those questions really made me think, and there were things I hadn't even thought of yet. And I spend every waking moment thinking about health and nature. So next up, we have our lunch. And so it'll be served